Welcome to Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware with Dr. Nicholas Biasotto. Dr. Biasotto is board certified in family medicine, and he has extensive experience and training in treating patients with addiction and substance abuse. Now, let's join Dr. Nick Biasotto for Delaware Healthcare Reality.
Hi, this is Dr. Nick Biasotto. I'm the host of the Medical Society's podcast, Delaware Healthcare Reality. We have a very exciting discussion today on a new and exciting screening test for cancer. It's called the Galleri Test, Galleri. This is a possible game changer, so I would like everybody to listen and listen closely. There is no other sentence that strikes fear in a patient than the words, "You have cancer." About 38% of men and women will be diagnosed with cancer at some point in their life, according to the data from 2018 to 2021. This is greater than 1 in 3 persons, and this is an alarming statistic. As of 2023, an estimated 18 million people in the U.S. are living with a cancer diagnosis. Before the advent of the cancer screening test we will be discussing today, we only have about 6 screening tests to detect cancer in its early stages, which is the way you catch a killer like this and hopefully offer a possible cure. As most of you know, these screening tests are mammograms, colonoscopies, pap smears, low-dose CT scans, prostate PSAs, and now we have these skin screenings that are done in dermatology's office. Leading causes of cancer deaths in America are lung cancer, by far the leading cause of mortality, followed by breast, colorectal, pancreatic, prostatic cancer, and the list goes on. The best way to cure cancer is through early detection, and this is what we will be discussing today. With the arrival of a new thrilling blood test that can detect up to 50 cancers before they become symptomatic, this is important. This test is now available and offered through a company that worked on its development. The company is called GRAIL, G-R-A-I-L, and the test is called Galleri, again, G-A-L-L-E-R-I. With this, I would like to introduce my guest. Her name is Lara Bagby. She is a field director at GRAIL, where she leads a national team of medical science liaisons and patient advocates. She's a board-certified genetic counselor and with over 20 years' experience in clinical genetics and industry. She earned her MS in human genetics from the University of Michigan. At Penn Medicine, she spent over a decade in prenatal genetics and implemented cell-free DNA screening in clinical practice. She later moved to industry as a medical science liaison to advance clinician education in women's health and genomics. Her current focus is on medical education for multi-cancer early detection. Welcome, Laura.
Thank you. I'm happy to be here.
Okay. I'm very happy to have you. This is something that I think we should spread as much as we possibly can, the information that we get here today. So tell me a little bit about GRAIL and the company's mission.
Yeah, so our mission is to detect cancer early when it can be cured. And it was formed as a company following an unexpected discovery in the prenatal space. And as you mentioned, I came from prenatal genetics and was involved in non-invasive prenatal screening, or NIPT, where we draw blood from a pregnant woman and it's able to screen for certain genetic conditions that a baby could have. In 2015, there was an article in JAMA that detailed the cases of 10 women out of 125,000 women who were tested who had a highly abnormal non-invasive prenatal testing result. And when they did follow up on these women, they had typically developing fetuses. What the test had unintentionally detected was cell-free DNA from tumors rather than from the placenta. And we were, when they looked at these women, they found that they had different types of cancer. And it was kind of this aha moment that we could say, oh, we can use a single biomarker in blood to screen for many different types of cancer. Nice. And so our goal is to work together with healthcare providers and patients to really to use this technology to transform cancer screening.
Very interesting. GRAIL's Galleri test is intended for use in individuals at increased risk for cancer and it can detect over 50 cancers, as mentioned earlier, often before symptoms even appear. For listeners, how does this breakthrough technology work, and why is a game changer for early cancer detection?
So I mentioned that you can draw a person's blood and find out information about a pregnancy or a tumor, and this works by looking at something called cell-free DNA in your blood. Everyone has cell-free DNA, but something with a different DNA pattern than you, such as a baby or a cancer, can also be detected. Cancers growing in the body may shed DNA into the bloodstream, and the DNA fragments can act like a unique fingerprint of cancer. And so the Galleri test may be able to detect such a fingerprint before symptoms appear. And as you think about it, cancers that don't have routine screenings are typically made, cancer diagnoses are typically made when symptoms appear. So the Galleri test may be able to detect such a fingerprint before symptoms appear. So cancer diagnoses are typically made either when symptoms develop and a workup shows cancer, or through recommended single cancer screens like mammograms and colonoscopies. And as you mentioned, Dr. Biasotto, there are screenings recommended for 5 specific cancers. And while these single cancer screens play an important role in detecting those 5 specific cancers today, nearly 70% of cancer deaths in the U.S. have no recommended screening test. And so the Galleri test is not meant to replace those single cancer screenings, but to work in addition to them to increase the number of cancers found as early as possible through screening.
So people out there, this is not the complete answer. You have to get your screening tests along with the Galleri test if you really want to get good results. Okay, how does early cancer detection change the trajectory of treatment and survival rates? This is important.
Yeah, so aggressive cancers can develop quickly and without symptoms, or very non-specific symptoms like fatigue or weight loss. And so cancer often hides, with symptoms not appearing until later stages. And so the earlier that cancer is diagnosed, the greater the chance of successful treatment and survival. And 89% survival rate when diagnosed early versus only 21% when it's diagnosed late, when it's already metastasized.
Big difference, big difference.
Yeah.
Can patients ask for this test now, and what's the best age to have it done?
So age is our single biggest risk factor for cancer, and the Galleri test is recommended for individuals with an elevated risk for cancer, such as those 50 and older. So as I said, age should be the first consideration for screening, just as we see for recommendations for mammograms and colonoscopies. But some people have risk factors that increase their chances of developing cancer above others their age. For example, cancer survivors, those with a personal history of cancer, and those who have an inherited hereditary cancer gene are at a higher risk than others their age to develop cancer. It is available, the Galleri test is available through prescription only, and it's not available to individuals who are pregnant, under 21 years of age, or who are undergoing active cancer treatment, which makes sense because if you already have cancer, you don't need to screen for cancer. Mm-hmm. And we do hear a lot about the incidence of cancer in younger people, and that was most recently reported by the American Cancer Society. We don't really understand all of the reasons for this shift, but it is something that we should keep an eye on, and also consider modifiable risk factors such as smoking, diet, UV exposure, and alcohol consumption.
I've raised these issues in earlier podcasts, is that we have the best of everything in the United States, schools, medical schools, research centers, hospitals, doctors, etc. And yet we fail terribly when it comes to outcomes. We're like 38 in the developed countries. No, we shouldn't be that high up on that scale. And I think that has to do with a lot of our lifestyle. Smoking, as you mentioned, eating the wrong kind of foods, alcohol consumption, etc. So this is a test that maybe can help us live longer, because they say the generation lower than I am, and I'll say I'm I'm the baby boomer generation. The ones lower than us are not going to live as long as we do. And that is because of, I guess, the way our lifestyle is in this country. Okay, what would you say about someone who is on the fence about getting this test, especially someone who feels healthy and has no symptoms?
This is a very personal choice. Everyone has a different risk factor for cancer based on their age and other factors. And so the question is the risk high enough to justify screening? And since this isn't currently covered by most insurers, it's also a financial decision. The good news is that for individuals in their 20s and 30s, their overall individual risk for cancer may be so low that screening is not recommended by their provider or other professional organizations.
We're going to take a break now before we continue with this very interesting discussion so that we can bring our membership up to date about some of the events we're having this month. So stay tuned. We'll be back shortly.
Information about the Medical Society of Delaware can be found on our website, medicalsocietyofdelaware.org. Questions about our podcast can be emailed to healthcare.reality@medsocdel.org. That's medsocdel.org. Once again, here's Dr. Nick Biasotto.
Hi, this is Dr. Nick Biasotto, and we're back from our break talking to Lara Bagby. She is talking about a cancer screening test called Galleri, Galleri. And we left on the fact that what about those people that are on the fence about testing, like someone who feels themselves very healthy? Now, take it from there. What do you think?
Yeah, so we talked about that people who are in their 20s and 30s are at low risk, and it might not be recommended by their provider or medical organizations to have screening. But one of the drawbacks of screening is a risk for a false positive result. That is a screening test result that suggests cancer may be present, but follow-up diagnostic testing does not find cancer. This happens with our current recommended screening test if something is found that requires additional imaging or even biopsy, but it can also happen with multi-cancer early detection tests and could trigger a workup that doesn't find cancer. But I would recommend anyone who is interested in cancer screening, whether with this blood testing or other screening options, discuss their individual risks, options, and the risks and benefits with their healthcare provider.
Yeah, in my practice, I've seen false positives in our usual screening tests, so that's not uncommon. What can a healthcare provider expect in terms of what results of a Galleri test that they took? What would that be?
Yeah, so the Galleri test result is binary, meaning there are two possible results: no cancer signal detected or cancer signal detected. If the result comes back no cancer signal detected, it is recommended that the patient continue with their routine recommended cancer screenings and consider getting repeat Galleri on an annual basis. If the test comes back as cancer signal detected, it will also indicate the likely origin of the cancer signal. For example, it could come back saying pancreas or head and neck. The origin prediction should be used to guide the diagnostic workup that is required after a cancer signal detected result. It's really important to note that Galleri is a screening test, so false positives, as we mentioned before, and false negatives do occur.
The good thing is that you can get the organ specific. That will make us zero in on that organ and do further testing, so MRIs, CAT scans, etc. True?
Yes.
Okay. How accurate is a Galleri test in predicting the origin of a detected cancer, and how does that guide next steps in the diagnosis? I think we briefly talked about that, but go ahead.
Yeah. So if the Galleri test report indicates that a cancer signal was detected, as I said, it will also report a predicted cancer signal origin. And this helps the patient and physicians direct the workup efficiently. In our clinical studies, the prediction of cancer signal origin is correct in over 93% of the time. We actually report out 18 different cancer signal origin results, for example, ovarian or liver bile duct or pancreas, as I mentioned before.
And one of the pancreas is always that last thing, and by the time you find out you have a pancreatic cancer, it's generally too late. So it would be wonderful if we can find this early. There's been a few of my patients, thank God, looking for something else. We saw a small lesion in the pancreas, and it was in the tail, and it was fixable, it was cured, and that's rare to hear. Mm-hmm. Okay, is there any evidence to suggest that residual risk for cancer may be after a negative Galleri test?
Yeah, so in our Pathfinder study, the negative predictive value was 98.5%. So a negative predictive value of 98.5% means that when the test result is negative, there is a 98.5% chance that the person truly does not have the condition for which they were screened. So out of all of the people who tested negative, 98.5% are actually disease-free, and 1.5% are false negatives. They do have the disease, but the test did not find it.
Interesting.
It's essential to note that the negative predictive value may vary depending on the disease incidence in the population, and individuals with a negative Galleri test result should follow their physician's recommendations for routine cancer screenings.
Interesting. That's pretty good, though. I would sure like to see a negative signal come back in me, you know? Well, one of the barriers to accessing the Galleri test is that many doctors aren't familiar with it. I have found that out just in my talking with other doctors, in other meetings when I discuss the Galleri test. And I've been a big proponent for years because I am attached to a company that backs us called MDVIP, which is a concierge practice, and they have been a big proponent of it for years and brought it to my attention, gave us lectures on the subject, and has really made my eyes open up to a better way to treat my patients and offer this test. Should Galleri and multi-center early detection testing become a standard part of preventative medicine rather than an optional enhancement? What do you think?
So GRAIL has a very strong clinical study program with a number of completed and ongoing research about the safety, implementation, and workup pathways related to multi-cancer early detection. And we're partnered with many premier health systems to continue to study and implement these tests. It's clearly important to both patients and providers to understand more about this potentially game-changing option and agree with new technologies like this. One of the biggest challenges is awareness and education. You've hit on our exact longer-term goal to make this testing available and accessible at a population level to integrate this into routine screening and healthcare. GRAIL has a national team of medical science liaisons whose job it is to educate healthcare providers about our data, case studies, and outcomes to move us closer to this ultimate goal.
Okay, Lara, where can people find GRAIL if they want to learn more about it?
So they can go to our website at Galleri, that's Galleri with an I.com.
Okay. Anything else you'd like to add?
I think, like almost all people listening today, I have been affected by cancer within my family and friends, and actually personally. And I feel very fortunate to be able to have the opportunity through GRAIL and the Galleri test to educate both providers and the general public about their risk for cancer and their options, including multi-cancer early detection, to live healthier lives. So thank you for the opportunity to do that through this podcast.
And thank you for the information, which has been very, very interesting, and I hope that our audience will take advantage of this. Go to your doctor and ask your doctor if the test is available and would he recommend it. And if he doesn't know about it, you educate the doctor. We've tried to, and we will continue to educate our physician population about this test so that they may use it. I think it's an important way to put an end to cancer deaths. This is Dr. Nick Biasotto. We're finished for the day. We had a very good, informative information that was given to us by a member of GRAIL. That's Lara Bagby. And listen and enjoy and get this test.
This has been Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware. For more information about MSD, visit our website, medicalsocietyofdelaware.org. For questions or suggestions regarding our podcast, email us at healthcare.reality@medsocdel.org. Thanks to audionautics.com for our music. The executive producer of Delaware Healthcare Reality is Mark Thompson. Delaware Healthcare Reality is produced by Tom Minton. For the Medical Society of Delaware, I'm Lori Ann Rhodes. Watch for our next podcast episode. Until then, be well. The Medical Society of Delaware, MSD, is providing this podcast for informational purposes only. It provides neither medical, legal, nor any other professional advice. The views, thoughts, and opinions expressed by the host or any guests are their own and do not reflect the views or policies of MSD. Unless specifically stated, reference to any specific product, service, or entity does not constitute an endorsement or recommendation by MSD. Reliance on the information provided in this podcast is exclusively at the risk of the listener. MSD expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, or other damages arising out of any individual's use of, reference to, or reliance on this podcast or the information presented in this podcast.